Thank you. Well, thanks to your efforts in following public health advice, our inpatient part of the hospital is really still quiet. In fact, we've only got 2 patients in our COVID ward, and we're looking at the best way to continue to provide that COVID ward, because having a whole ward for 2 patients, we might be able to do that in a different way, and we can always switch back if we change that. So we're having a look at the hospital layout and how we best deal with the continuing small numbers of inpatients we have with COVID, which is great news, actually. We're looking, as I mentioned last week, a little bit at how we can get a bit more routine activity through the hospital. It's really complicated because everyone has to be screened and take precautions and all that stuff, but we're looking hard at how we can do that. And I know a lot of people out there are anxious about their appointments and when can they get investigations done. And we are working hard to try and get back to some sort of semblance of normality, even though we know that people waiting for elective and planned operations and things have been waiting a long time now, and it's going to be hard to get back to normal in this context. So the inpatient part of the hospital is quiet, but it's not all quiet. I'm really pleased to say, because we've encouraged people to come forward to primary care and to the emergency department. Emergency department activity is inching back towards normal, actually. So people are clearly restoring their faith in coming into the hospital, and rightly so. So I just continue to say, if you need to come into the hospital, we're there for you. So thanks for taking that advice. The other part of the hospital that's been really quite busy is the mental health part. Mental health services have been really quite busy over the last few weeks, and it's not surprising. We've changed the way a lot of people live and deal with their conditions, and put a lot of stress on people. And so all I'm going to say about that is the services are open. They're continuing to deal with their existing clients, and they're taking new urgent clients in the normal way. If you need help, they're still taking, and they will still take referrals in the normal way from emergency department and primary care if you need that sort of help. Working closely with partner organizations so that people who don't need hospital type or secondary health type care but need some sort of support can access that. And that's all from me today.
Great. Okay. Thank you.